Here we are, having dealt with unseemly trials and tribulations in what will have been a black month in the history of our country. A lot of people have died. A lot of people have suffered. Now, the statistics, the tables are telling you things are getting better. In very real sense, in Delhi, things are definitely getting better. But that doesn't take away from what has already happened. Now, the question that we have to ask ourselves, and we're going to listen in to conversations on this, is that in the interim period, what do we do? Because we still have to function as a country, and that is the economic activity of everything that we do. I'm obviously, you can tell behind me, stuck at home because there have been consequences impacting all our work life. Some things are possible and some things have just become impossible to do once again. We had this conversation very early last year. I remember in February, March of last year with Dr. Kohli and others to prepare for a stimulus. And here we are in 2021. Now, while we are now better, more effectively dealing with oxygen situation, hospitalization situation, we'll have to once again deal with the economic situation. So what do we do? Karnataka is becoming the first state that's kicking this off. My colleague Jayaprakash has spoken there with the Deputy Chief Minister, and they're putting together an economic relief package. Let's listen into that full interaction. It's about 3-4 minutes long. Let's listen to that interaction and open up this debate to conversation.
With regard to the testing, we have made it very effective. Earlier, there used to be more of pooling tests. Now we are emphasizing only on single test. Earlier, by pooling, for every one test, there used to be 5 pooling. So the number used to look very big, but actually the number of tests was conducted was less. Now, to make it effective, we are emphasizing on only single test. At the reports earlier, it used to take 5 days to 7 days. Now, most of the places we are getting within 24 hours from the time of collection to delivery of reports. This has become very effective, and more so, some places, except 5 places, remaining places it is underutilized. Underutilization of the lab is happening. So we are going to direct them to ensure the adequate, proper utilization of the lab. See, in government itself, we can conduct tests up to 1,01,000. In the private, it can be up to 75,000 RT-PCR test itself. So in this direction, we are going to redirect them, see to the whatever maximum they can make use of the existing available RT-PCR lab, it will be done. And more so earlier, everywhere they used to go for the checking in the bus station, railway station. Now that situation is not there. You know very well now, since the lockdown is there, the question doesn't arise. And earlier, it used to be more to the unwantedly, the screening used to happen in a very big numbers, and pooling used to happen. Now it's the single number, it is effective within 24 hours. Along with this, each day now we are going to do rapid antigen test, not less than 50,000. So that is going to add up and ensure it will be more than 1,50,000. And as well as including the RT-PCR scaling, it will be in big numbers. If you actually see, the number of single tests now being conducted is much more than earlier, and it is a solution. It is more of a solution than compared to the previously.
That was the Deputy Chief Minister there in Karnataka speaking about how they're ramping up testing facilities and other things which are important. Karnataka is still not past it. It's still having high caseloads. Bengaluru has a much higher caseload right now than Delhi at almost 8 to 10,000 cases per day. Now, Karnataka is becoming the first state in the country that is now announcing relief measures for people. My colleague Jayaprakash will be joining us in just under a minute to explain those to us. Question we have to ask ourselves is what is possible and now what is needed across the country. Dr. Sharad Kohli is with us on the conversation. Yamini Agarwal is joining us on the broadcast as well. And Sampath Raman, who is chairman of the All India Manufacturers Organization out of Karnataka's chapter and has been associated with ASSOCHAM also in the past, joining us on the broadcast. Dr. Kohli, in a difficult circumstance, when we were doing the budget this year, which was a continuation of all the stimuli that came our way last year. We could not fathom a situation like this. But the reality is, even though there has not been a nationally announced lockdown, Delhi has been locked down 5 weeks now. Maharashtra has been locked down a better part of 2 months. These are Delhi is a major financial center, Maharashtra major industrial hub and financial center. Now Karnataka, Tamil Nadu, Odisha, Bihar, everything is under lockdown. So we have to assume that a national lockdown for at least a month or month and a half has happened. As we exit it, what do we need to do?
Well, I think, Rishab, a very important aspect. I remember when we were children, we used to play spot the difference. So, if you try and spot the difference between last year and this year, apart from the massive tragic numbers, the massive deaths, I mean, the overall number, this is probably 4 times or 5 times more severe than last year. On the economic front, we've been noticing a difference as well. We saw multiple Atmanirbhar Abhiyan announcements, multiple Reserve Bank of India announcements last year, one after the other. There used to be a PC. I remember I was on your channel several times. Every time there was an announcement, and this happened, in a staggered manner, and the total ran up to 25-30 lakh crore. I mean, what was the essence of it? It's a different story. This time, I think the government has decided to honor the federal system of the country and probably disseminate the responsibility to the states. So not just the lockdowns were regional, but we are also forcing, as Karnataka has taken the lead, I personally feel this is the beginning of another federal pattern which we are going to see, that you might have states coming out with their own stimulus packages as compared to last year, Rishab, when we saw the nation, the center taking the lead and making successive announcements.
In which areas? Because if you're operating. So are we saying that if you are in the, let's say, the retail industry, Karnataka might give you something and Maharashtra might not? Will that help or make it more complicated?
Well, it's both ways. See, when center took the lead, I think the solace to the citizens of the country was much more, because you saw the Prime Minister coming on board. You saw both the Finance Minister taking the lead. So obviously the announcements of pan-India. The difference in states, because each state has a unique structure. Each state's economic parameters are different. Each state's demographic requirements are different. So we might see, Rishabh, a different kind of stimulus is coming, like Karnataka today said, we will give it to auto drivers, cab drivers, rickshaw drivers, and so on. So we'll try and, I think no state can ignore, Rishabh.
A bit of that already, but again, it's
no state, just one sentence, no state, Rishabh, would be able to ignore the bottom-up approach. That is going to be the common thread throughout.
Okay, so it's a bottom-up approach, there's no doubt about it. Okay, but in this logic, here's since Dr. Kohli said what's different. What's different this time around is that interstate transport or travel has not stopped. Migration has happened.
Yes.
But it has not. Trains have continued to run, the planes have continued to fly. And if you want to drive from one border to the other, in most places you've been able to move around. So Yamini Agarwal, there are some differences where there has not been a national lockdown, where you can't go from Delhi to Bihar if you wanted to. You could this time. Migration has happened. And I'm assuming that there are economic consequences. So do we now need a stimulus? And if so, is it okay if the states announce schemes? Do we need central level schemes? What needs to happen?
Well, as you clearly pointed out, that the difference arises from the fact that last year it was a national lockdown with essential transportation being also stopped, right from railways to air, as well as your buses. There was a difference in terms of providing the poorest of the poor and the most vulnerable with the facilities of food, cooking gas, cash in their hands, in their accounts, which were provided by Atmanirbhar Abhiyan 1, 2 and 3, which was close to about 13% of the GDP as a stimulus which was given. When we do see that, this stimulus was supposed to help, there was a further stimulus which was given to take care of the healthcare system, whereby 137% increase was made in the healthcare system for diagnostics and the others, which needs to be completely implemented to come in force for the stimulus. Again, to provide for employment, infrastructure facilities are being developed. So there is an already ongoing stimulus which has been provided by the government. Also, the RBI provided the requisite stimulus. So that national lockdown and the recovery phase was to be improved in that process.
So you are not saying desperately that next week we need, an announcement to come. You're saying that there are things already work in progress. But Yamini, Agarwal, the Americans are doing exactly the opposite thing. No, they are in fact working on, stimulus number 4 now, or the 3, and at huge amounts. So why are we thinking a different model will be better for us?
Well, we have been thinking about in providing the states the opportunity to come up with the relief packages which are needed for the vulnerable in their areas, because now the lockdowns are limited to the states itself. And what needs to be recognized is, since the state participants would be affected more and not the overall country, the stimulus needs to come from the states itself. So the particular structure which is there,
stimulus is that if you say, okay, I give all the auto drivers in Mumbai something, but then you have to be accredited, card carrying. If you are an Ola driver, you might not qualify as something, so you might not get help. It's a bit complicated, and of course, all of economics is complicated. Let's find out a ground reality check. JP, I'm just coming to you. Sampathji, what is your view on this? Should there be now from state and center welfare schemes, including stimulus to industry, or no? Because let's say the steel sector has been shut for a month to provide oxygen for all of us. Should we say that they should speak up and not worry about it?
Yeah, let's get this clear. You see, what Central announced, what Nirmala Sitharaman announced, 25 lakhs package. This is all concerning how to revive the industry. So, how to provide loans for the MSMEs, how to provide production links incentives, and so on and so forth. They are on national scale, and it has to be dealt with the center alone. So that again has to be re-examined and something has to be done there. That's a different point. What Ediyurappa is doing is a welfare scheme. If you remember, the best welfare organizer of the country was MGR. Have you heard of MGR, the actor? He became the Chief Minister of Tamil Nadu and he squandered the entire budget on welfare. At that time, perhaps whether it was needed or not needed, I don't remember. But today, what Ediyurappa is doing is absolutely necessary, and I would rather say that he should give a little more to the poor. And if he gives to the poor, where does it go? It again goes to meet the consumption. The consumption is going to trigger demand, and it has got the ballooning effect of improving the economy. The whole thing is very much needed. If the other states don't follow, they are not doing the right thing.
Here's the economics of it. For people watching the broadcast, the economic argument is of the bottom-up approach is that people who are the lowest income earners, if you give them a 2,000 rupees stimulus or help, they are likely to spend the entire 2,000 rupees and not save 300 of that because they don't need to spend it. So that 2,000 rupees gets churned into the economy, and that of course then demand goes up for biscuits and toothbrushes and stuff like that, and then industry benefits.
It should not be 2,000, it should be 5,000.
Okay, it should be more. Let's find out what's actually happening. JP, this welfare scheme or help or aid or stimulus, what is the plan? What is being developed in Karnataka?
Well, Rishab, welfare scheme, yes, this is not election time. These are times when people have been finding it difficult to meet their ends. There's complete lockdown. You have people locked up in their homes. They cannot step out. They can't earn their daily bread. And this has come a day late and a dollar short, you can say, because we are already 20 days into the lockdown, and now the stimulus is being spoken about. Last time, not stimulus, but then aid, you can say, financial aid, financial assistance. Now, last time when the lockdown happened, 1,400 crores was announced, and aid of 30,000 rupees per hectare, which is about 2.5 acres for example, for floriculture, which was announced. By the time it could reach, everything was fizzled out, the market was back, and they didn't need that money. And then that scheme actually died down. Now also, the opposition is attacking this 3,000 rupees stimulus or financial assistance that you've announced. What is the framework for that? How will the beneficiary get the money? And how are you going to process the transfer of money to their account. Now, these are the ground realities. Now, both Siddaramaiah and Kumaraswamy have attacked us, Yediyurappa, that you have announced 3,000 to 6,000 rupees packages across the sector, auto rickshaw drivers, cab drivers, push cart vendors, footpath vendors. But how is it that you will ensure that that money reaches them? You have a lockdown happening, all the systems are shut, there is absolutely no communication. In this process, is it just a lip service? This is the critical question which is being asked by the opposition today, and quite valid too. Now, stimulus that you are discussing about happens at a multiple level. Now, last time also, I actually want to bring this pertinent point here. Last time also, they announced a 20 lakh stimulus package for different industries. They announced moratorium for all those middle class and upper middle class when it comes to EMIs. Now, who would want to push 3 months further and double the interest rate, and then finally the principal also grows? It doesn't help. And this time around, where is the RBI? There is absolutely no announcement. Now, the central government has said that under the Disaster Management Act, it's up to the states to announce. You tackle it at your level. But today, when the same question was asked to the Chief Minister as to what is there in store for the common man, for the middle class, he says that it's on central government, it's the RBI which has to take cognizance of all. Not us.
So the question is now, do we need to do something? Because, like I mentioned, the American stimulus model has been completely different to ours, and they are still doing it. They, in fact, under a new president, under a new Constituent Congress, they've come up with another stimulus plan for 2021. Okay, JP, I'm going to let you go. Thank you for putting in that information into this conversation. Dr. Sharad Kohli, that begs the question: do we now need to look at the economy as requiring of a stimulus? Because currently nobody seems to be talking about any plan in the works.
Yes, Rishab. Why nobody is talking about was because the Jaan obviously is much more precious than the Jahan. So people thought this is not the appropriate time to talk of the GDP or the fiscal deficit and so and so. But the fact of the matter, Rishab, is that the situation on the economic front is very, very precarious. 75 lakh people, Rishab, lost jobs in the month of April. This is the CMI data. I mean, the data is not coming from thin air. Only in tourism industry, 1 crore people have lost jobs. In restaurant industry, something as simple as restaurant, around 7 million people, they contribute 4 lakh crore, 7 million people have lost jobs. Now let's look at the broader parameter. The broader parameter is that last year, when the budget came, in fact in February, why last year, our fiscal deficit was crossing 9.5%, 18 lakh 48,000 crores. And we were borrowing 12 lakh 5,000 crores, which was pegged as the borrowing limit. We were planning to disinvest. Now, the broader question, Rishab, is that who doesn't want a stimulus package? I'm sure the government wants to give it. The citizens want to take it. But where is the elbow room? If you take the total fiscal deficit of the country, Rishab, I mean, to make it simple for the sake of NewsX viewers, it is about 13 to 14% if you include the states also. In fact, it could be even 15%. The financial position of the states, Rishab, is, by the way, not very good.
Where the Americans have trillions of dollars in debt also. So the logic applies is that do you do stimulus spending or deficit spending as it's called or not? And there's no easy answer. In economists, if you have an answer, you can take the economic prize. Anybody watching, you'll get the Nobel Prize for it if you can figure this out. Yamini Agarwal. So now let's take the example. The Maharashtra example did the same thing with auto drivers, etc. Delhi is saying that for 75 lakh ration card holders, we'll give free ration for I think 3 months. They've given free ration. Now that is about saving lives. This is humanitarian aid. It's nothing else. This is not economic stimulus. There's a difference between economic stimulus and humanitarian aid. So humanitarian aid obviously has to come first. But do we also need to think of economic stimulus maybe next month?
Well, we do need to think about economic stimulus as well as we need to think about economic relief. Relief first and then the stimulus. The stimulus has already been offered in different means. So when we talk about the stimulus, whether it is in terms of tax cuts or whether it is in terms of providing free certain amount of cash transfers, it needs to be thought about because right now the situation is pretty bad in terms of what people are sustaining this lockdown with. the poorest of the poor do not have food to eat, do not have money to spend, and they need to be provided for. So a relief needs to be provided for them. Similarly, the Manrega or the other schemes or the infrastructure development needs to provide the stimulus for the employment that is needed, much needed. So the spending needs to be there by the government.
Spending needs to continue. So, for example, the massive infrastructure projects which are happening need to happen at a greater pace now, which is road building. And you can argue that you can create new industries out of thin air. Oxygen generation can become a new industry. But I'll give you an example. Sampathji, in a very real sense, are you getting approached by colleagues, fellow business owners, entrepreneurs, who are saying once again we are wrecked and we might not survive this blow?
Absolutely. There are people calling me and telling me, and there's a guy in Chennai who is doing the survey. He gets the picture. He has interviewed not less than 3,000 entrepreneurs and MSMEs, and he has got the picture that about 40% of the industries are sick, and many of them will wind up. See, the difference between the pushcart fellow on the road needing some money and it's a social welfare which you are doing is different from what loans are being given to MSMEs. When the loan is given to MSMEs, we are postponing his demise. When there is no business, if you give me a loan, what do I do? How do I pay it? I am facing that problem. See, if there is a business, I can pay out of that income. I am only postponing my debt. This is happening to 40% of the industries.
Okay, so Dr. Kohli, I'm out of time. So we were hoping to have an optimistic scenario of maybe north of 10% GDP growth this year on a low base, of course, of last year. That was, of course, on conversations that were happening 2 months ago. There is no doubt that a lot of damage has been done. Is 2021 going to be as bad as 2020? Maybe worse?
Well, so far, so fingers crossed, but so far it seems like it's going to be a very, very tough call. Rishab, 50 crore people earn in this country. Out of that, 90% earn less than 20 or 15,000 rupees. They are in the informal sector. I think they'll be the worst hit. If we address that problem, we would have addressed the industry, we would have addressed the MSMEs, we would have addressed the bulk of the problem. So I think the informal sector, 40 to 45 crore of workforce, Rishab, they need to be taken care of. The middle class will probably have a drawing room debate and will quiet. They're not going to come out on roads. They'll sit and discuss among themselves in the drawing room and be quiet.
There's no doubt about it, sir, that all of us, my savings are gone in the past 1 year. Because
exactly.
People who you're trying to help, right? People in desperate situations. So you're just rolling out money, and I'm not thinking about next year or the year after that.
And Rishab, a Provident Fund, half of the people have withdrawn 1,25,000 crore rupees from Provident Fund, 3.5 crore people who've withdrawn. People are out of their savings now.
Wherever I'm telling you, whatever liquid assets that I could think of, that were in my name are gone in the past 1 year. I have not had much spending because I'm stuck at home or maximum going to studio and coming back. But there's so many people who needed help, and if you 5,000 rupees here, 10,000 rupees here over lots of people is lakhs and lakhs of rupees, and that's not investment. No, there's not a loan I can say I'm going to take it back. That's it has to be a grant in aid in desperation. We need to have these larger conversations. Sampathji, last quick words, and I'm out of time.
Yeah, only one thing. See, in spite of the fact that Kohli ji told about 12.5 lakh crore deficit, and it is going to balloon further.
It's 18 lakh crores. It's 18 lakh 48,000 crores.
So in spite of that, I am an advocate of deficit financing. See, from the days of 39, 40, when the Great Depression was there, and John Maynard Keynes, he advocated deficit financing. And it's only a matter of time between the adjustment of the demand and supply. So when you deficit finance, demand is created.
Okay, the opposite to deficit financing is debt. Okay, that's the lesson you learn from places like
US is now calling it quantitative easing.
Well, whatever you want to call it, you learn that lesson from Greece that if you actually are in trouble and you cut back on spending, you get into further trouble, not in improvement. And here we are. Greece was 2008. Now, 12 years later, the economy has not recovered. So something will have to be done. There's no doubt about it. Is the room very, very tight? Yes. But we keep coming up with these plans that we'll do the divestment and this will happen and that will happen. Now we need to actually work out those plans and they have to just get done.
Room is not tight. We are afraid. We are scared. We should not be scared. We should.
And there are many reasons for that. We get worried about Moody's and what the S&P will do and what these guys.
Moody.
I think these all things play factors. Now we're not living in an island, so we have to worry about these things. But the conversation for this is now well and truly begun. And we have to have it because the ruin that this is going to happen. I'm sure all of you watching this broadcast have seen, barring those doing black marketeering and oxygen concentrators, all of you would have seen your savings being depleted. Maybe you're in debt. Maybe it's credit card debt that you maxed out on. I'm maxed out on all my credit cards. And I'm thinking, okay, fine, eventually I'll pay this off over the next 1 year. But it's a very real scenario.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.